Okay, so we're back for more fun walking through the headlines about women's health. So here's a story you probably heard. Women react to news about a new over-the-counter birth control pill. This is a progestin-only pill. Women will not need to see a provider or have a prescription to access it. And this is important because nearly half of all pregnancies in the United States are unintended. Rates are highest among younger women, women in their 20s. And for younger people, accessing birth control can be very challenging. They don't have proper sex health education in their school. So there are a lot of people that just don't have very good information about birth control. And so it's important to increase access and promote health. Um, and it's further complicated for people who are low income, who have transportation issues, people who live in rural parts of the United States, where maybe their options of going to a healthcare provider are limited. One unresolved concern about this is the cost. Most women in the article admitted that they would pay between $20 and $30 for a 1 month supply of Opill. One of the things about Opill, it's not as effective as combined oral contraceptives, but it is less risky. It does not have the same risk of cardiovascular blood clots, adverse side effects like that. But as a progestin only pill, women need to be educated. They need to take that pill at the same time every single day to prevent ovulation. And there's another link to that article. Medical gaslighting. This is one of those issues. Most of us who are women, if you're watching this, have experienced some form of gaslighting. So, gaslighting, you probably know from social media and TikTok and other outlets, is when you try to make somebody feel crazy when they're not. And the term medical gaslighting refers to instances where a healthcare provider either dismisses somebody's concern and minimizes it, or they outright ignore a patient's symptoms. And this can lead to delayed diagnosis, misdiagnosis, and it can actually kill people. So this article sort of references a TikTok video that went viral. This woman filmed herself in a doctor's office and her husband in a doctor's office. When the husband went to the doctor and he reported feeling fatigued, his physician promptly recommended sleep apnea tests, which is reasonable. But when his wife came in and reported a constellation of symptoms, including chronic pain, fatigue, low energy, diminished libido, which is sex drive, painful intimacy, her doctor nonchalantly dismissed her concerns with a derisive, "Welcome to motherhood." As it turns out, she had chronic endometritis, like an infection from her C-section that had been performed 2 years prior. So she wasn't treated appropriately until she advocated for herself. And that's kind of scary. But it happens in all areas of medicine, not just OBGYN. It happens mental health. It happens physical health. Sort of that it's all in your head. And if you could just cope better with your life, you would feel better. Women across the globe identified with her ordeal, and she was flooded with comments on the video where many, many women shared experiences of being neglected by their healthcare providers, or they reported gaslighting in medical settings, which is, kind of sobering. Okay, on a similar subject. More young women are getting breast cancer. They want answers. And the article does not make it clear what's causing breast cancer in younger women, but the current recommendation for mammograms is about age 40. And they've increased it somewhat because of the increased incidence. Women really should examine their breasts. I mean, it's not considered to be effective. They don't really recommend it anymore. But if a woman examines her breast, she's going to notice when something's wrong with it. Anyway, so cancers of all types are on the rise for younger Americans under the age of 50, but particularly among women, and that's not exclusive to breast cancer. It includes things like colon cancer as well. There are some factors that will predispose some women. Later childbearing, earlier menstruation, later menopause, because the exposure to estrogen, obesity, certain diet, lifestyle choices, weight control, alcohol consumption, environmental exposures can also influence the rate of breast cancer in young women. But there were a slew of women who were interviewed by these authors. Um, and in the interviews, young women with breast cancer said they felt dismissed by their doctors when they first raised concerns about their breast health. They noticed a change. They saw something, whether it was puckering or dimpling or asymmetry or a lump. They went to their providers and were told it's all in your head. There's nothing wrong with you. You're too young to get breast cancer. And now a growing group of patients and experts are calling for further research and conversations about breast cancer among young women, because these women are starting to advocate for themselves. But it's a shame that they have to um, go that extra route. It's a shame that they weren't listened to and they were gaslit by their providers. Okay. Okay, on the subject of female cancers, cervical cancer home testing kits could ease barrier to access and screening and prevention. And this is especially true for women who live far from healthcare providers if they're in rural areas, but it's also true for women who find uh, going to the gynecologist uncomfortable, unpleasant, or even triggering. So, according to this Dr. Jeff Andrews, who is an OBGYN, 30% of American women are under-screened or not screened at all for cervical cancer. That's a pretty high percentage of people who aren't getting a very routine healthcare screening. Black and Hispanic people are at higher risk of not being screened. That's another health disparity. Adding that if they are diagnosed with cervical cancer, their health outcomes are lower than those of white women. They're not just being under-screened, they're being under-treated. Self-testing is a viable option for increasing access and health equity. And it kind of makes sense. If you can buy a very affordable test over the counter, and you don't need to make an appointment with a provider, you don't need to interrupt your work schedule, and you don't need to subject yourself to that exam, this could be very empowering for you. All right, now we're on to another treatment. So we've talked about cervical cancer, which is related to HPV, and also, it's cancers related to breast cancer. Moving on to HIV. You may have seen the ads on late night television for a product called PrEP or Truvada. And you might notice that it is almost exclusively marketed to men who have sex with men. Only 30% of the people who are at risk for contracting HIV are taking PrEP. That includes people who use intravenous drugs, people who are exposed to high populations where they live of people with HIV and that might become part of their sexual partners. So it's underused all over the place, but only 7% of PrEP users are women. And because PrEP has been historically heavily marketed, I'm quoting directly from the article, to men who have sex with men, it really gave the impression that PrEP was not something that cisgender women could take. And unfortunately, women heard that message from their healthcare providers. Black women, who account for half of new HIV infections in women, are on PrEP even less than white women. They aren't being offered this treatment, and this is an important health issue. So, all right, now we're moving on to another really big news issue about women's health, and you might be somewhat familiar with this. The maternal mortality rate in America is shameful. We spend the highest amount of money per person on healthcare, and we have the highest maternal mortality rate of any high-income country. So maternal death is up for everyone, but even more alarming is that certain populations are at 3-4 times the risk of white women. And in some areas of the country, they might be at 20 times higher risk. So this new report highlighted dangers faced by Native American women who have not been discussed as much as African American women. Native American women were 3.5 times as likely to die during this critical period, this year after childbirth, or the whole pregnancy and the year following, compared with white women. Black women also faced heightened odds. Going to move my little box again. Whoops, got to go back. Oh, sorry. Anyway, Black women are also at higher risk. This study said 2.8 times. I have heard 3, but in hearing speakers talk about this topic, in some counties, like some places in Louisiana, a woman is 20 times as likely to die as a white woman. And that is true for Black women who are highly educated, have higher incomes, are health literate. And it's not because of any inherent biological vulnerability. It's not because of anything other than systemic racism and provider bias, implicit bias. Black women are taken even less seriously than white women, and white women are taken less seriously than men. And that's just the truth of it. So this is a program that this article just came last week to my attention. Black women in the US are about 3 times more likely to die. We just said that. Recent CDC survey found that 1 in 3 women of color reported being mistreated while receiving prenatal care. Common complaints included requests for help being ignored and unwanted treatment being forced on them. Women who didn't want epidurals who were told that they had to have them. Women who didn't want C-sections who were told that they had to have them. And they felt that they weren't being respected or listened to. So this program in Oakland, California is pretty revolutionary. I gotta move my box again. Sorry. Beloved Birth is what it's called, and it's based on a model called Centering Pregnancy. It's group healthcare. It's tackling racial bias by pairing Black patients with Black midwives and Black doulas, and having group sessions so that they have 2 hours to talk about all their concerns and learn from each other and with each other, and help them make informed decisions about their medical care. And that extra time is possible because it is a group model. So they come in, they have their blood pressure taken. It, they go behind a curtain, they weigh themselves, and then they all get into a room in a group. And all of that important healthcare promotion, health education, discussion of options in childbirth and in pregnancy, all of that can happen. And it can happen in a group format. And you guys know when you're in a class, sometimes you have the freedom to ask a question or someone else asks a question and answers a question for everyone. All right. We are going to cut this video off here and pick up again about what it's like to be a woman in other parts of the world, showing you the map, this little sneak preview. So countries like Norway, Italy, Spain, France, they have better rates than us. But we're better off than people in sub-Saharan Africa, the Middle East, and parts of Eastern Europe and Asia. So just something to consider. I'll see you in a few minutes.